What are the three approaches for hip surgery for a hip replacement operation? Three approaches. My name is Dr. Dan Albright. I'm an orthopedic surgeon in Raleigh, North Carolina. I specialize in hip replacements. Did a fellowship in hips and devote a large part of my practice to replacing the hip. There are three approaches to the hip. And as a surgeon, we're of course focused on anatomy. That's one reason we all became surgeons, is because we love anatomy, and anatomy is crucial to what we do and doing it well. This is a model of the hip. This the plastic outside is the skin. Take that out. It represents the skin. And then there are three parts to the hip that we explore with surgery. We go from the front, which is my preferred way, from the front, and I'll tell you why in a minute. We also go from the side, which I do sometimes with tougher surgery, revision surgery. If someone's had 3, 4, 5 surgeries, cancer, just some unusual situation, I'll go lateral. It's a good way. And then there's posterior, and that's what most of the country does. Our whole culture, this is the gluteus maximus, your buttock muscle. And that muscle is split with the posterior approach. And that's what our culture is centered around is the posterior approach to the hip. That's what's most common. That's what you will hear about. And it works. I have a lot of colleagues across the country who do the posterior approach. It's a good operation. There's controversy amongst us surgeons. We all think the way we do it is the best. In my hands, and I've done all three approaches, in my hands, the anterior approach is what I believe works the best. And one reason is you split muscle and you don't stitch muscle back to bone. And it's my belief that there's less dislocations after. There's some debate on that topic, but I have no restrictions after surgery. And that's a real big deal. With a hip replacement operation, you can tie your shoes first day if you want. And with a posterior approach, I mean, there are some real restrictions for some surgeons. And that's held true over decades. So not dislocating is a big deal. Less muscle damage is a big deal, in my opinion. I don't sew anything back. I just close the skin. That's pretty much what I do. And the fascia, which is the covering over the muscle. So it's a pretty quick procedure going from the front, and quicker recovery, in my opinion. Patients are out of bed within a couple hours usually, and then home by the next day most times. So one night in the hospital, it's possible to go home same day, but that's not something I'm trying to encourage right now. But one night in the hospital, home the next day is the norm. And that's pretty good, especially compared to the old days. Years ago when I trained, people were in the hospital for a week, 10 days in traction. It was quite different. So we've made a lot of really nice gains with technology. Just the evolution of hip replacement surgery has been very good. And I encourage you to Google anterior hip replacements, because there's a lot of good information out there. I trained at Yale years ago. We were a center for anterior hips and really got some good training. Did a fellowship at Harvard in hips. So I really like to focus on it because people are happy after they get this operation. They have a better life, a healthier life. So I'm happy to talk to you about anterior hips, why it's better than I think than any other approach. My website is danalbrightmd.com. Appointment line, phone number is 919-863-6808. Happy to see you anytime. Thanks.